Dr. Meyer, you had your ribbon cutting ceremony last week. Very cool.
Great turnout. Thank you to everybody that showed up, and great event. We had a full evening for about 3 hours straight. We had a steady stream come in, get a peek at the beautiful clinic that my wife helped create, and so many wonderful volunteers from the area and amazing team. It was a great official kickoff to a new start for folks, a wellness journey, a wellness walk, and as we've talked before, Dave, just about not accepting that, hey, this is my lot, my slow decline, there's something else I can do to live better and to have that quality of life. So that was the kickoff, and we're really getting our DPC rolling, which is the direct provider care, which is me getting back out there doing family practice again, only doing it from a perspective of this integrative look, this integrative practice where I've got, as I always talk about, my tools in the tool belt, the regenerative, less conventional methods, and then some of the conventional tools to help people with their acute and chronic care. So please, give us a call to sign up for that. It's a monthly membership, and you can come in for a wellness DPC, direct provider care visit with me. That's complimentary. To learn more about it, be very happy to show you the clinic too if you didn't get a chance to be in for the ribbon cutting. I always like to walk people through, and people are often surprised at all that we have to offer. So many great team members that want to help out and welcome you and want to get you feeling better.
So people have been very receptive to, number one, Okoboji Wellness Clinic and the different tools in the toolbox, but they've been receptive to the style of care that you're giving because you and your staff are giving patients time. You're not treating them like numbers, not moving them in, moving them out like cattle. You're actually treating them and hearing their needs.
Absolutely. That is a pressure that I no longer have. So it's a beautiful thing. God's blessed me with this journey, and to be able to then bless folks that come in the door with a visit that I'm not, as soon as you got one foot in the door, ready to say, on with the next person. No, it's that 30 to 60 minutes is there. And again, you've got unlimited visits to come in as part of this membership to see us, to see me. And so what we don't tackle in 30 to 60 minutes, we can reschedule for the next day or the following week, and because again it's an onion. We all have layers that we've built up over time with toxins and traumas that we've been exposed to, and so a lot of times it takes some time listening and hearing you through your history to be able to get to the bottom of things, to get to the root cause, to help identify what is the best route where we start first. But lots of pivots along the way. But yes, it's not going to be a rush visit at all, Dave. It's going to be something where you feel like you're coming to our living room, and we've got beautiful pictures on the wall that are high vibrancy pictures from Cherry Lane Farms with microgreens up, and all these life-giving things that are going to make you feel like you're not in a sterile environment, but an environment where you are relaxed and ready to just learn more about the path forward.
One of the things that you talked about is being free from some protocols, and one of the things we all do in life is we learn as we go. And certainly COVID was a learning experience. One of the things very early on that I'm not sure anybody did in a way that they didn't think was helping, but there was a lot of remdesivir given and a lot of ventilator usage. Statistically now, and looking back, that would appear that was about the last thing that needed to be done. And so you're able to bail on that type of a protocol because you can say, that's not working.
Absolutely, and it is, the whole vitamin D, that was a huge thing, and as far as, wow, there's so much more than just the pharmaceuticals in every case, and so sometimes we need those in an acute setting if it's a hypertensive high blood pressure crisis, but there are other times when we got a little bit more time to work on the mind, body, soul, and we can peel these layers back, maybe do some supplements or some natural methods or modalities. For instance, we continue to work with folks that have had the COVID trauma as a result of the injection or the just having COVID itself, the virus, and what we start out with, again, many times it's the hyperbaric therapy, but if you are not looking at what are the traumas that you develop over a lifetime, and COVID being the latest trauma, and so that what can happen is that can just create a memory in the mind, in the subconscious level, that gets our mind stuck, and so is our body sometimes even ready to receive some of these therapies? Sometimes if our mind gets stuck in this trauma, we got to help that trauma, that subconscious mind, move along. So there's things that we're partnerships that we're working with in the clinic now as well. We had a family come in yesterday that we sat down with a colleague of mine and worked on some of this trauma, and because ever since she had COVID, it was brain fog, fatigue, body aches, and she shouldn't feel this way. She's in her early 50s, late 40s, early 50s. And so we're going to start working on this subconscious side of things now, which is that memory that exists in the brain from different layers of trauma over a lifetime. And again, her latest one was COVID, but, you go back in life, you look at inflection points in life, whether it is there was an argument that you got in, or there was, a work situation that was unhealthy. If that is not moved on, because we go through these subconscious, we try to protect the brain and deal with it, but if we don't move that on, that can manifest and ultimately turn into problems. Almost, it can turn into disease. And so that's where we take this full multifaceted approach, and that's what we talked about with this family last night, because there were some aspects of the therapies where, the hyperbarics, although, man, it's been amazing. We had this lady, the update from Ohio, that she called me last week. She's like, this hyperbaric stuff is still incredible for my COVID long haul, and now we're going to add oxygen concentrator for her. But the couple that was here last night, she was not making the progress that we were liking to see. So I think we needed to delve more into what are some of the things that are getting stuck for her, some of these traumas that we can, through different techniques. There's things out there. One thing is emotion code, and the other thing is something called Psyche. But these are techniques and folks that have been doing them for many, many years. It's a gift that they're able to share and kind of be another tool in the toolkit. And then we can go back with this family and say, all right, we've worked through some of this trauma, we've moved that on, balanced it, and then let's try the hyperbarics again. Let's try some of the other amazing things out there through the functional medicine world, working with Ellie and Ma Molly in the clinic because we want to break this inflammatory cycle that exists. We're seeing that with so many different conditions where we're sick and we're inflamed. It's this inflammatory cycle. And the ways that we break that, there's resveratrol. We can get into glutathione precursors. There's so many, and then it's the modalities, the hyperbarics. But it's like, an artist that you go out there and you got the different tools, and everybody's unique. Everybody's their own little palette in their painting. And, Bob Ross with Pretty Little Bush over there and that pretty little mountain. Everybody is different. And so that's what we want to recognize. Everybody's different, but there are trends and patterns that everybody has as well that we can use these different techniques and approaches to get them back on their feeling better.
And I do think that's important to understand that people are different, and we need to go here. But for example, people have handled having COVID different. You're talking about somebody who's really had nasty long-haul COVID, stuck with long-haul COVID, where other people have had it, got it, they seem to have gone on. Medicine, for example, you and I have talked about this, how some people are extremely sensitive to medicine. I happen to be one of those people, where other people not as much. I'll give you just another example. Lene and I can be sitting side by side in a gnat-infested area. She might be okay. I am just swarmed under. We're just different.
Right. Yep, absolutely. We are different. We've got different genetic makeup, different energy, different frequency. When you go into the room with somebody that you can feel their good energy, that they just are emanating joy and happiness. Those are the kinds of things that we are a lot more complex. God is a beautiful God and has made us, we're just scratching the surface from our understanding of how to better care for us, God's children, and that's kind of what we're here for, is to discover all those different ways and apply them and give you the time to sit down with us and talk through it, be comfortable, and be well. So,
all right, got to let you go. Again, OkobojiWellnessClinic.com. Folks can find you how?
Give us a call, 712-339-6024. We're in the building just north of Fix Ace Hardware in Spirit Lake off 71. So we are easy to find. Come say hi. We'll be happy to walk you through.
Very good. Dr. Meyer, thank you so much. Dr. Bradley Meyer, Okoboji Wellness Clinic. Again, find them at OkobojiWellnessClinic.com.